So what should we know as we get older? What affects our mouths as we get older? Well, as I already showed you, if people are no longer able to take care of their own mouths, then it's possible they'll get this situation where they have infected mouths. So that can happen. But other things happen to us as we get older. One is that our immune systems get older. Now we have lived for the last couple of years through COVID, and you saw how terrible that was. And it was particularly terrible for older people living in long-term care facilities and nursing homes. And there are several reasons for that, but probably the main reason is that their immune systems are not as healthy. I know with me, if I hurt myself or get sick, it takes me a little longer to get over it. Well, as you get older, that continues to happen. It just takes longer to get healthy. So our immune systems are not as healthy, and our ability to heal up from an infection or something. So that's one of the reasons why it's very important to keep people, and this is what you do every day, you're helping to keep people healthy and infection-free, because if they do get infected, it's going to have a worse consequence than if, say, you or I at a younger age get infected. So the other thing that happens when we get older is very often we're on multiple medications. And I'm sure you know that your clients are taking a lot of medications, and that's good, if they need to take them, because it helps to do things like reduce your blood pressure and control other, diabetes and stuff like that. But pretty much almost every medication has the ability to give you a dry mouth. And besides you may have clients who have said, I have a hard time swallowing pills, or my mouth is so dry. One of the reasons is that besides getting older, that tends to happen, is because medications can give us a dry mouth. And the implication of that is when you have a dry mouth, you can get a lot of cavities. So this is somebody who had a dry mouth, and if you see, the cavities are all kind of by the gum line. So I'm showing you this because, if you're looking at someone's mouth and you see something like this going on, you need to tell their children, you need to tell their nurse that, did you know that Mrs. Jones has this going on? I saw this, I went to a lecture, and now I kind of know what's going on. So what's happening here is that because the mouth is dry, the food isn't going off the teeth as it normally would with saliva, and it tends to collect by the gum line. And that's when food is not taken off the teeth, it tends to cause cavities. And also your saliva is very important, because your saliva keeps your teeth kind of slippery, and also it has antibodies in it and things that neutralize acids. So a dry mouth is a real problem. Also, it's a contributing factor towards aspiration pneumonia, because they have a hard time swallowing. The other thing that happens as folks get older, there's an increase in oral cancer. More people die from oral cancer than they do from certain types of skin cancers. So it's a real problem, and it happens in the older age group. And the reason I'm showing you this is that I'll show you some slides later. If you see something that's abnormal, you don't know what it is. It could be something just normal, that's an accident, or it could be a beginning of some kind of cancer.